from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is Healthcast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to Healthcast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about the nursing residency program at Sarasota Memorial and how it leads to better outcomes for patients. Our guest today is Leah Robinson, who is a doctoral prepared nurse and the Nurse in Professional Development Specialist for the nursing residency program at SMH. Leah, thank you so much for joining us.
Thank you, Allison, for having me.
So first of all, what is the nurse residency program and is it required to be a nurse here?
Yeah, great questions. So a nurse residency program is really initiated at the end of nursing school, and it starts really once you get your NCLEX. So once you complete your nursing degree, you sit for boards. Once you pass boards and you're licensed, you could potentially start in a nurse residency program. Nurse residency programs are developed to help the new nurse transition to professional practice. One of the big things that we see with nurse residency programs is that not every nurse residency program is the same, and not all organizations have residency programs. So to answer your question about if residency programs are required, they are not. A nurse could leave nursing school and go directly into practice without participating in a residency program, and it would be totally appropriate because they are board certified. Nurse residency programs, however, have become more and more popular over the years as we find that there's additional training and support that's needed.
So why do these programs exist?
Yes, the nurse residency programs exist for a variety of reasons. One of the big things that they really identified early on was the difference between what we see in the academic setting versus what happens in the clinical setting. So nursing school really prepares nurses to develop that knowledge and expertise in some of those specific patient population groups and learning more about the disease processes. As they are able to be prepared and ready to sit for boards, it allows us to say, all right, we have the knowledge as a nurse to be able to take care of patients. However, when it translates into practice, every organization runs a little bit differently when it comes to policies and procedures, and that's really outlined by the organization itself, by the different guidelines set before us, whether it's through joint accreditation, joint commission, or other more governing bodies like the World Health Organization and the CDC. Part of the organization's role is to make sure that as we bring in new hires, especially newly licensed nurses, that we're preparing them well to take care of patients and providing them with safe, quality care. Nurse residency programs came into existence to help support that transition. The things that we learn in nursing school help us with that knowledge, but then putting it into practice can be an added challenge. One of the big things we saw, especially recently with COVID, was nursing schools weren't allowed to enter into the clinical environment as much. So one of the things that we identified during that time was that there was a gap between a nursing student's and newly licensed nurse's knowledge and their ability to put that and practice it and demonstrate it. So nurse residency programs really, in the last few years, became very evident and it became a more focused attention for a lot of these new nurses coming into the environment. And that's one of the big things we see now with our nurse residency programs and the value of being able to take that knowledge and put it into practice.
Why did Sarasota Memorial decide to create a program like this here in Sarasota?
One of the big things with this community is that it's growing. And one of the great things about the fact that it's growing is that we need to make sure that we have the tools, the resources, the personnel to take care of our patients. We've seen in the past few years, Sarasota Memorial has grown, not just in the number of beds, but in specialties as well. We've seen the oncology tower open, and there's new and advanced things going on within some of these specific specialties. We're bringing in surgeons from across the country that are performing very specific and different types of procedures that we haven't seen before. And a lot of times with nursing schools is we keep things pretty general and pretty broad. And when we transition into practice, those specific things aren't always discussed in the level and the detail that we need them to be able to care for our patients safely. So one of the things with the nurse residency program was making sure that we can, one, develop and build a robust and competent nursing workforce. And with the nursing workforce today, especially post-COVID, there's a lot of need to be able to support our nurses and make sure that they're well cared for and make sure that they have the education and training to be successful. As we grow, one of the big things we see is we need to bring in newly licensed nurses. Experienced nurses are hard to find these days. It's becoming a bigger challenge. We've had the baby boomers who are leaving the nursing profession, and rightfully so. They have done their fair share of the nursing work in the past many years. And now we need to enter this new nursing workforce. And the best way to prepare our nurses to care for this complex and challenging environment is to give them that support with a nurse residency program.
You mentioned earlier that every nurse residency program is very different. So can you tell us about SMH's program specifically?
Absolutely. And correct. Every nurse residency program is different. The nurse residency program we run here, it could be very different than a residency program across the country. Some of the things to look for if as a new nurse is what type of residency program am I looking for and why does that matter? Our residency program is what we call PTAP accredited. PTAP stands for Practice to Transitions Program accreditation, and it is awarded by ANCC, who also awards magnet status. And they are the ones who really promote and support the development of our new nurses. Without that particular accreditation, there's nothing to say that we're being held to the same standards and guidelines as a program somewhere else in the state, in the country. So those organizations that have an accredited residency program really sets them apart from other standardized residency programs. With some of our accreditation components, we do need to make sure that we're following and abiding by them. One, because it really supports that new nurse's development, but two, it also protects that nurse from things that they may not have been aware of when they started in this new role. In addition, our accredited programs are also looking to identify what things are we doing for our patients? What kind of quality measures are we tracking, are we seeking to make sure that we have a structure and a process in place for our new grads to be able to transition successfully and have great patient outcomes?
You mentioned magnet before, and SMH has magnet. Do you think the magnet accreditation is in part because we are preparing our nurses at Sarasota Memorial with programs like this?
Absolutely. Magnet is really valuing nursing and the wholesome aspect of nurses, not just what we do in the nursing environment and in the clinical setting, but what happens behind the scenes, what kind of programs are put in place to support these nurses as they are doing the day-to-day tasks. In addition, Magnet wants to make sure that we have a very well-established workforce and a healthy workforce. There's been a number of studies and literature out there that has identified a healthy nurse is going to provide healthier patient outcomes and better patient outcomes. When you have a nurse that is competent and is comfortable in what they do, they're going to be able to take that patient and that patient's needs and advocate more for those specific needs. So they really do go hand in hand. And Magnet is kind of a part of the ANCC component when it comes to designation and accreditation for the PTAP as well.
Aside from the designation, what sets SMH's nursing residency program apart?
Yeah, absolutely. One of the big things that we see in the nurse residency program is that we have a structured and very robust program. One of the big things that we like to make sure we do is before a newly licensed nurse starts, we're giving them that opportunity to know what kind of environment and what kind of practice that they're looking to get into. There are so many different specialties out there, and as a new nurse, it can be very difficult to identify, well, where do I want to go for the next 10, 20, 30, 40 years of my career? And is SMH going to be the place that I want to do that? When we developed this program, we wanted to make sure that we're supporting that nurse in whatever needs that they have. And this program was developed way back in 2006. So it's been 17 years now. This is well before COVID, well before it became the hot topic of today's nursing world, because we had identified that these nurses need additional help. So some of the things that really sets our program apart, besides the fact that it has been a well-established program, is that we have continued to grow and change it throughout the years as times have changed. Specifically, we have a few things that include clinical orientation, classes, structured, didactic, and lectured hands-on experiences, as well as some wellness components. one of the things that we see with our new nurses is that if there's other things going on in their personal life, it's really hard to transition to a new role in the nursing world. There's a lot of things that happen in the clinical environment that can be eye-opening that maybe they weren't exposed to during school. Giving these nurse residents the opportunity to communicate those concerns, to share their feedback, to give them that time to communicate with their peers and know you're not alone in some of the things and the concerns that you have. The other big component that I always like to advertise is that we have a partnership with Ringling Museum just down the road from here, and we work with them in utilizing what's called visual thinking strategies. And this is an evidence-based approach to help support our nurses or any healthcare professional develop some of those visual thinking strategies and observation skills to further improve their patient care. A lot of these initial studies had started in Harvard Medical or Yale, and they started with some of these programs in visual thinking, and there's a lot of publication in medical journals, but there really is not as much in the nursing world. So we took some of those studies and some of those practices and put them into our residency program, and it has been such a treat to be able to go to a beautiful setting like Ringling, be able to pay for these new nurses to go there, take them and help them with visual thinking, as well as provide them with a retreat-like experience. We also have a mentorship program. We do know that even after clinical orientation, there's growth that happens. Clinical orientation can take anywhere from 8 weeks to 24 weeks, depending on what specialty you're going into and the additional learning that goes along with it. But throughout the first year, there's a number of studies out there that show you need additional support to help that transition. And one of the big things we see is that even after orientation and you're on your own and practicing independently, having that experienced nurse that's there and understands it, has gone through it before to help kind of mentor the way can really be a huge benefit for our new nurses especially.
Who is eligible for the SMH nurse residency program?
So the nurse residency program is really intended for any newly licensed registered nurse who has less than 12 months of nursing experience. Traditionally, this would be anybody who comes right out of nursing school. You do have to sit for your boards and be licensed in order to enter into the residency program at Sarasota Memorial. But once you get licensed, you would be able to be enrolled into this residency program. We do have what's called practice settings. So there are specific units and areas that participate in the residency program. Some of the more specialized areas have their own orientation and residency components, and you can find out more about that information on our website.
Why is this program so important to the nurses who have participated?
Yes. The nurses who have participated, which have been many, I've been in this role for almost 4 years, and just looking back at the number of nurses that have entered, it has been well over 600 that we have onboarded and trained in the last 3.5 years. And what we see in those nurses that have participated in the program is that they really do a wonderful job of being part of their units, being an advocate for their patients. A lot of them have gone on to take leadership roles. As we grow organizationally, and we have the hospital in Venice, and we have the additional towers that have popped up, we also see that within our organization, the people grow. And those that have participated in the residency program are the ones that we now see sometimes sitting in manager roles or those assistant manager positions, in addition to being an active member of their unit and participating in the task forces and participating in some of the specialized resource teams, and really being a great resource to anyone in the hospital.
If a nurse is graduating soon, recently graduated, sitting for their board soon, how can they learn more about potentially getting involved in this program?
Yeah, absolutely. And we love having nursing students reach out to us because that's a great time to get started in identifying where do we want to go and what do we want to do and how does SMH really set itself up differently than other organizations. But if you're looking as a nursing student and you're looking to identify where do I want to go in my career and is SMH the place that I want to be, one of the big things that I'll say is start off looking at our career page website. You can go to smh.com/careers and it'll outline the nurse residency program. It specifies what exactly the nurse residency program entails and what kind of things and practice areas are included in that. In addition, it has our contact information for our human resources department, and they can reach out to either myself or Vivian Cruz, who is the other residency program coordinator, and we can help answer those questions.
We know how this program impacts nurses. You've just discussed the many ways that it helps nurses improve and be prepared to work in whatever setting they choose. But why is this program important to our patients as well?
Absolutely. And I think that's really what this all comes down to is why is this program so important for our patients? At the end of the day, if you're a patient here at Sarasota Memorial Hospital, we want to make sure that you're getting the best and most highly supportive and safe care that we possibly can provide. And by allowing our staff to be effectively trained and oriented and feel enculturated into the organization is only going to serve our patients better and improve our patient outcomes. And so I think the big piece with Sarasota Memorial and the residency program, I think it just shows that when you have an organization that puts this much effort and this much support into new nurses coming into their nursing career, it's only going to improve patient outcomes and it's only going to help our patients in the long run.
Why is it important that a community hospital like SMH has a nursing residency program like this one?
Yeah, being a community hospital, we serve anyone in our community. We serve all walks of life. And so being able to bring in highly competent nurses and train them effectively is going to allow our nurses to be able to identify what are the specific needs of this particular patient or this patient population? What are some of the challenges seen in these particular settings? And how can we be there to improve and address some of those issues as they come up? In addition, like I had mentioned earlier, it's a community that's growing. And I think as the community grows, our nursing population needs to grow as well. And we need to continue to look into developing these new nurses and molding and setting that way before them so we can have them effectively trained. And as we grow with the community ourselves, we want to make sure that we're having a safe and effective environment for our nurses. There's been a lot of talk since COVID around the nation about how safe, how healthy are our nurses. Our nurses are burnt out. Our nurses are concerned about, their safety. And at Sarasota Memorial, we make sure as a PTAP accredited residency program and as a magnet organization, we really put a lot of focus on the health and well-being of our nurses, and that being a key point, and a healthy and good working nursing workforce is going to relay directly to our community and the community's needs.
Awesome. Leah Robinson, thank you so much for joining us today and sharing so much information about the nurse residency program and how it relates to our patients as well. It's not just for the nurses. As always, we encourage everyone in our community to visit smh.com to get the latest information from Sarasota Memorial. Have a great day.